Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. It is just gone 8 o'clock. This is News and Views right here on Salam Media. And our first story, not a moment too soon, is with Dr. Dasoo. He is one of the people or one of the healthcare professionals with the I Am movement signatories. And obviously, this has to do with the poor state or the sorry state of state hospitals and clinics, and apart from the sorry state of those institutions, also just the way healthcare professionals are managed in state care facilities. Assalamu alaikum to you, Dr. Aslam Dasoo. Welcome to the program.
Wa alaikum salam. It's good to be with you.
Lovely to have you on the show. Thank you indeed for your time. Now, you are one of the people, one of the 7,000 healthcare workers who are demanding change from Makhura and Joe Phaahla regarding I guess, the working conditions and even just the way healthcare professionals are treated in state hospitals and clinics. How did this all start up? We're talking 7,000 healthcare workers. Good on all of you guys. We do know also that sorry story about the whistleblower, Dr. Demaya, who was suspended at the Rahima Musa Child and Mother Hospital. So let's go and look at obviously the 7,000 workers demanding change. Do you think that you're going to be listened to? And do you think that these changes will be implemented almost immediately?
Okay, so I convene the Progressive Health Forum, which is part of a very wide national advocacy network of health workers. And when the letter was published by Dr. Demaya regarding the atrocious conditions at Rahima Musa, he struck a nerve when he did that. It's not the first time that whistleblowers, health professionals, have spoken out about the intolerable conditions under which they work at our public facilities, especially here in Gauteng. And it's gotten much more problematic over the last couple of years, but it's been a long time coming. You know, the public health system here in Gauteng is arguably the most complex health system on this continent. And one would expect that the Gauteng Department of Health has a commensurate management approach to that. That doesn't seem to be the case. We have serial failures. We have deep administrative problems. The health workforce in our facilities, especially the professionals, have been fairly silent, not because they didn't want to speak out, but because there's a very draconian set of conditions of service which prevents them from doing so. And I think what Dr. Demaya did by speaking out was showing the limits of that. You know, say that he's tried all the channels that are in place repeatedly over months and months and months with absolutely no effective response to the queries. Now, that tells you that there's a structural and a systemic problem in how the system is managed. At the outset of your program, you were talking about a plan from the president for ESCOM. You know, that has taken long enough, but at least there's a plan now. There isn't one for the public health system.
Sure.
And arguably, this is as important as our power generation system. So when 80% of the population, over 80% of the population is dependent on the public health system, you want it to be, effective and efficient. But it isn't, leaving mainly those who cannot afford private health care at much greater risk. And this need not have been the case at all. And that is how the I Am movement began, when a few clinicians added their names to a petition decrying the situation. It was 140 odd leading clinicians, from the dean of the medical school to the heads of departments, etc., who signed up to the open letter that was sent. to the minister and to the premier of Gauteng, because the officialdom in Gauteng was completely unresponsive. That letter then stimulated a clamor from health workers across the country in the public health service, particularly to want, demanding to append their names to that letter, which is what has happened over the past few weeks and which has culminated in the follow-up letter we issued yesterday.
Okay, so when was the letter sent? And please tell me if you've received a response, or are you still awaiting a response from, obviously, the powers that be, and that is David Makhura and the Minister of Health, Joe Phaahla?
Okay, so on the 21st of June, the letter was dispatched, the first open letter, and was published in the media. And we wanted to go with an open letter because the official channels, get mangled in bureaucratic processes. You may get a response, you may not get a response. And we didn't want to go that route. The more important element of the I Am movement is also a stance of defiance that these people wanted their names made public, being associated with this letter, which would normally invite victimization and intimidation from health
Mm.
department officials. So, and that's what happened to Dr. Demeyer. You'll recall he was suspended, and then there was an outcry, and he was apparently reinstated. But that was a lie. He was reinstated, but the disciplinary processes against him were still continuing because the officials will brook absolutely no protest. There's a kind of, undeserved power they wield over health professionals. And so by signing up to this I Am uh, uh, movement, health professionals were saying so far and no more. And there's a very, very good reason for this. Health professionals work according to an oath and an ethical framework.
Mm.
And when
Mm.
your administrative rules violate or force them to violate those oaths, there's a kind of moral injury that occurs to health professionals. And so then they either leave or they speak out. And what we're seeing now is that health professionals are defying the state quite correctly, and we are encouraging that by going public everywhere they are about the poor state of public hospitals. This is a national heritage of the people, and it doesn't belong to the government. They are just a temporary custodians, and they have to do their jobs. So the response you asked, there was a meeting, I think it was around the 11th of July, which involved some of the department officials, I think in response to the pressure that went to the politicians, and 20 leading clinicians from 20 of our hospitals here in Gauteng met with them, led by Professor Rudo Mativa, the head of ICU at Dara.
Mm.
And there was a lot of discussion and a lot of nodding of heads. Yes, we understand and we agree with this and we will do this and do that and we'll come back to you. That then falls into a hole. That's the usual pattern, and that is what has happened here, which then, required of us to escalate the issue, hence the letter yesterday. So that's where we are. There's no other official response to this. But what is likely to happen now is that this list is going to grow and it's not going to be ignorable, you know, and eventually it's going to be the senior political leadership that are going to have to do something about it.
Mm-hmm.
And if you have read the open letter, the demands are very clear and they're very straightforward, and they're just a couple of them, that if implemented can make fundamental difference to how public health services are managed.
And undoubtedly, the public health service is in a really dire state as we speak. I don't even need to make this comment. You, as Dr. Aslam Dasoo, um, you're well aware of this. But there's so many other little issues that I want to pick up regarding our public health service. Let's just start with the next question being, since the I Am movement has started, and since a party have already met with the powers that be, government officials, have there been any further reports of victimization?
Well, this kind of thing happens generally under the radar. because the health professionals tend not to speak out publicly. So it's hard to track something like that. And that's not surprising because they are intimidated, their careers are at risk, and they would rather just either keep quiet or leave.
Mm,
So I'm sure they are. And if the department is forced to open up all of its disciplinary processes, you'll find many of them there. Now, with Dr. Ganea, and we pointed this out in the first letter, that the disciplinary processes that have been instituted against him have not yet been withdrawn, which is our first demand. That hasn't happened. And the second is that they have to institute an inquiry into what happened here at Rahima Musa, because our view is that it's a proxy for all of the other hospitals. That if you do the inquiry here, you'll understand exactly what's going on in a range of the other facilities. And it's all systemic and will all point to the things that need to be done. And that is effectively to make sure the public health administration rules do not force health workers to contravene their ethical remits, and
mm,
that the rules don't carry over from the apartheid days, the draconian legislation that allows officials to rule the roost over health workers. And very important element of this is the lack of devolution of authority to the hospital's community itself. They remote control it from head office. They centralize all the power. They parachute in CEOs into hospitals without any concurrence with the board or the clinicians there. And then you just have to live with it. We're saying those rules all have to change. They are old, they must be thrown out. And those officials who resist that are basically being anti-constitutional. And the politicians need to understand that. And I think that's what is coming out of this. Yesterday, the SRU announced that they're doing a deep dive into 11 government departments. Well, try this. 10 of those departments are the Department of Health at the national level and the 9 provincial health departments.
mm.
So it's an area of great concern when
Absolutely.
a quarter-trillion-rand budget is at risk like this that requires this level of investigation. So that adds to the problem, unfortunately.
Okay, so Dr. Dasu, in your correspondence, your letter yesterday, uh, do you give the government officials a deadline? Because if you leave it open ended, they may never come back to you and they'll just drag their heels. That's one of the issues. And then, of course, I'm going to digress here a little bit, but it all has to do with health services in our country. A while ago, we heard about lots of um, deaths of babies at state hospitals. Would you attribute this to the poor state of services and facilities in our state hospitals? And I don't want to open up another can of worms, but these questions do beg to be answered.
No, I think that's exactly correct. You will have noticed over the years, we get these horrifying reports of disasters, serial disasters at our public hospitals. You write about the number of babies dying, both at Rahima Musa and at other hospitals, pregnant women dying or getting very ill because of poor care. And that's not because the health workers don't want to care, it's that there are too few of them. And the facilities they work under, which is the responsibility of the administration, are decrepit. Now, that's why there's a huge medical legal bill that the government is facing as a result of this. And, they can blame all the crooked lawyers they want, but 80% is exactly the result of neglect. And this is unacceptable, actually. So the letter yesterday didn't put a deadline, but the journalists did extract from the Department of Health a commitment. Well, the spokesman said that there was a commitment by the minister and the premier to attend to this matter. Now, we know they can often fob us off with those kinds of statements. But here's the difficulty they have. These workers have now all broken the law, the provisions of the administration and the conditions of service by going public. So what
Mm,
is the department going to do? They are obliged to act against them. And we're saying, sure, go ahead. Because this number is now 10,000, it will become 20,000. You can just try that. Or you can seriously consider the alternatives we have provided. And I think that takes a political decision at the highest level to do, you know. And until that happens, we can put deadlines, whatever, and I don't think any change occurs there. So this is a persuasive approach to the powers that be. Attend to this. Do these couple of things. Set up proper hospital boards who properly qualified people who will appoint their own CEOs. They will be accountable to the hospital community and will report to the provincial legislatures because it's a public institution, and work with the provincial administration, with the medical school training program platforms, and so on. And that's fairly easy to do, but it requires a political decision to do it. And I don't think we are there yet, but we may get there as this campaign grows.
We certainly hope so. It sounds almost as bad, if not worse, as the Eskom scenario. And I guess it does require civil society, like they've done with Eskom, to start making noises for them to be for the health department to take notice of what exactly is going down in state hospitals. I know one of the tactics they do also use or throw out to the public is that the healthcare system is overstretched because of illegal immigrants in the country, and they are creating this huge burden on the system. Your thoughts on that matter?
So that's absolute rubbish. Of course, there are immigrants in the country, and many of them undocumented, and they need care. That's a constitutional right of anyone in the country. The problem is that that's not properly managed. So first, the problem is the failure of Department of Home Affairs border management. You don't blame, people for coming across if you can't prevent them from coming across, and if you turn a blind eye or you're willing to take a bribe. So there's your problem. Don't blame the immigrant. When the immigrant requires health care, when a woman who is pregnant is required to give birth, we are constitutionally obliged, and the health workers are ethically obliged to treat that person. And that must be factored in the administration, which does nothing of the sort, but which tries to scapegoat foreigners and blame them for their inefficiencies. So that's absolute rubbish. And we reject that fully. And I think what is important here is for people to understand that this system caters for the poor. And it's the poor who are often voiceless and powerless, and they ride roughshod over their rights. This is unacceptable, and this government, this liberation government, which was meant to empower our people, is actually failing them on a basic thing like healthcare, which is a national heritage or public systems, and it's a national heritage of the people. It must become the system of choice for healthcare, the system of choice for healthcare employment. It has all the potential to be a shining public health system that can be an example to the rest of the continent. But, there's no stewardship in that direction at this point. In fact, the national department, because hospitals are managed provincially, the national department doesn't do much about that, but engages in distractions like the NHI and so on. While
Well,
facilities, the public system, which is required to deliver NHI, decays and is in incipient collapse.
you preempted my next question. I was going to ask you, and they want to introduce NHI. Gosh, I really and truly worry about that scenario, but I think we need to leave the NHI issue for another time. I really want to unpack that with you. For now, let me just read out a comment by a listener, Leah Lynette Robry. Thank you indeed for writing in. She says, power back to the people of South Africa for future generations. Our professionals should not be afraid to speak up. You are our first line of defense against greed and selfishness. Thank you, dear doctors. So that's from a listener, and that is Leah Lynette Robry. I need to ask you one or two quick questions before we wrap up. And that is, I did want to raise NHI, but I think that's going to be quite a long response. So let's leave it for another time. The fires at Charlotte Maxeke, and there were also fires at Barra, and also the wholesale theft of hospital supplies. Do we believe that that is sabotage and greed? What is going on there? Why are these people trying to cripple an already crippled system? Do they want to dig it into the ground? And do you believe that it's taking way too long to get Charlotte Maxeke up and running efficiently like it used to? And last but not least, Barra was world renowned. I remember back in the day, people couldn't wait to do their com service at Barra because they said that that's the best training they would ever get. What's your thoughts on all of those issues? My final three issues that I've raised with you this morning.
Okay, let's see if I can recall all of them. But essentially,
Yep.
the issue around these fires are a big concern. There are two elements to this. One is that there is clearly a, a shadowy insurgency, and we saw it with the July riots last year,
Mm,
that will seek to embarrass the incumbent administration. Okay, and this may well be a result of factional battles within the governing party.
mm-hmm,
So
mm-hmm,
that may, and hospitals are a vulnerable target. So they can do this. But the second important thing is that the hospitals are so poorly secured by the same administration that you can easily attack them. And so there is a responsibility on the current administration for its poor management. So if you take Charlotte Maxeke's fire, last year in April it occurred. The hospital is still functioning suboptimally. Uh, Theaters are closed, operations are being cancelled, cancer treatment is delayed, and so on. Now, this is over a year later. For the last year, the Department of Health here and the Department of Infrastructure were bickering around who is going to fix it and who will pay for it. And all that period, the hospital was taken out of the system. Now, if you take a major cog like Charlotte out of this entire healthcare machinery, the other hospitals will pick up the slack for a while, but eventually their services will falter, and that has happened. So over this year, there have been numerous preventable deaths that sits at the door of this government because it's preventable. And there were huge intimations of corruption in the rebuild of Charlotte. Now there is a plan apparently with the DBSA to rebuild it, but it's way behind schedule, and we're not sure about who's going to be paying for it
mm.
and how it will be paid for. So that's Charlotte Maxeke, and it's a signal example of this administration's inability to manage our public resources. Last, you mentioned Dara. Dara is a study in and of itself. As a result, after the Second World War, it became a whole bunch of barracks were turned into a hospital for the southwestern township, and it has grown into a world-class facility in terms of tertiary care, in terms of specialized care, trauma management, and so on. Dara too, as a result of the Charlotte shutdown, took on a load that that is causing it a lot of problems. And COVID revealed the gaps in the system. And I will tell you this: the reason we came through COVID, through the public hospital system, the public care system, is because of the health professionals. No thanks to the government, none at all. The health workers went under the terrible conditions in which they worked, went beyond, above and beyond the call of duty to care for people and to come out with as minimal numbers of deaths and debility as they did. And this is in the face of no resources. So our health workers have proved themselves. The politicians and the administrators certainly have not. And I think that's where we are right now. And, if the government doesn't put a priority on looking after our public infrastructure, like ESCOM, like our hospitals, then one has to ask, what are they actually doing?
Lining their pockets. And that's where we'll have to leave it, unfortunately. Wonderful talking with you. Thank you indeed for your insights on this very, very important issue, and that is our healthcare system. inshallah, we will talk with you again in the future about NHI, and also to get an update on where we're at with your negotiations or your talks with the government officials around this movement. So all the very best, and assalamu alaikum to you.
Wa alaikum salam. Thank you very much. Bye-bye.
That was Dr. Aslam Dasoo, one of the I Am movement signatories, and you've heard that interview. He was really explicit in everything that I put to him, and he's really made us understand clearly what exactly is going down in the country and in our healthcare system. The time is 8:35, exactly in a minute or two. We will be joined by former Chief Nuclear Officer at ESCOM, David Nichols, about Ramaphosa's 10-point power crisis plan. Everything you and I need to know. So please stand by for that interview, inshallah.